Students, in this video we are going to see the muscles of the back and the posterior compartment of arm. Number 1, from the lower end, number 1 it is latissimus dorsi, swimmer's muscle. Number 2, the bulky one is your teres major, and the third one is teres minor, the slender one. And then go here and check the spinous process. Okay, below the spinous process, the oblique muscle is infraspinatus, and then come here. This is your deltoid. You can see the muscle fibers, they get its attachment to the deltoid tuberosity, and then come here. This is the triceps. The long head of triceps is here, which takes its origin from the infraglenoid tubercle, and the cut end, you can see the lateral head of triceps. This is the lateral head of triceps, which takes its origin from the surface above the spiral groove. Okay, look at this. You can see the radial nerve in spiral groove. Okay, you can see the radial nerve in the spiral groove. So, above the spiral groove, yes, this is the radial nerve in the spiral groove. So, above the spiral groove you have the origin of long head of lateral head of triceps, and below the spiral groove, okay, inside, look at this. Yes, here you have the medial head of triceps. Below the spiral groove you have the medial head of triceps. All these three heads, long head, lateral head and medial head, they come joined together and get inserted into the olecranon process, posterior surface of the olecranon process of ulna. The nerve supply is long head and medial head. It gets its supply from radial nerve from axilla, and lateral head, medial head, they receive the supply from the radial nerve in spiral groove. So, the radial nerve in spiral groove, it is another one spotus. So, they tie this radial nerve. So, you should write radial nerve in spiral groove. The sub question is radial nerve in spiral groove supplies. It supplies the lateral head, medial head and anconeus. There is a muscle by the name anconeus, it is seen here. So, the three muscles are supplied by the radial nerve in spiral groove, and with two cutaneous branches. One is lower lateral cutaneous nerve of arm and posterior cutaneous nerve of forearm. Totally 5 branches are there for the radial nerve in spiral groove. Along with, in the lower triangular space, this space is also called as lower triangular space. This space has two contents, one is radial nerve, another one is profunda brachii artery. That is all. And you can check all the muscles, and teres minor is nearby the deltoid. So, both of them, they have the same nerve supply, axillary nerve. So, axillary nerve, it has two branches. So, anterior branch supplies the anterior fibers of deltoid, and posterior division supplies the posterior fibers of deltoid and teres minor. And you can see the spaces here. This is upper triangular space. The boundaries are superiorly teres minor and inferiorly teres major, and laterally you have long head of triceps. And the next one is lower triangular space. Here the superior boundary is teres major, you can see from here teres major, and then the next medial boundary is long head of triceps, and the lateral boundary is shaft of humerus, and the contents already we have enumerated, radial nerve and profunda brachii artery. And the third one is the quadrangular space. The boundaries are superiorly teres minor and inferiorly teres major, and medially long head of triceps, and laterally you have surgical neck of humerus. The contents are, you can see very well, the axillary nerve and posterior circumflex humeral artery. That is all.